Sure. The interest in neoadjuvant therapy for colon cancer, it's still up and coming. There basically is some very intriguing data to suggest that immune checkpoint inhibition or immunotherapy may have a role in early stage colon cancer. There's some promising activity in early stage colon cancer as well as early stage rectal cancer. Both studies, NEST 1 and 2, it was a very small study looking at the role of neoadjuvant, basically BOT and BAL, so botensilimab and balstilimab, in a very small pilot study looking at early stage colon cancer, which suggests that there's actually activity not just in a small number of patients they looked at with MSI-high patients, but also in the MSI-stable patient population. And that's really intriguing. And actually there was some early data from Miriam Chalabi regarding the niche study published many years ago that noticed that giving nivolumab and ipilimumab actually still had activity in early stage colon cancer. And I think that was what really kind of drove this kind of thought process moving forward. It's very intriguing. And then in rectal cancer for earlier stage disease, MSI-stable patients, there was a very nice single institution pilot study, once again, of 38 patients called TARZAN, which also looked at the role of bevacizumab and atezolizumab, so another immune checkpoint inhibitor in early stage rectal cancer, suggesting pretty significant potential activity, including non-operative management. So I think for moving forward, we obviously have to validate these findings and we need larger studies to be completed. There are ongoing studies being developed in the United States and internationally, really looking at this patient population, not just MSI-stable, but also MSI-high patients. Yeah, I'm not sure about here in Asia, but in the United States, it's become a standard of care now regarding total neoadjuvant therapy. When we mention total neoadjuvant therapy, we mean concurrent chemoradiation therapy or radiation therapy, followed by chemotherapy, and then consideration of sphincter preservation and a non-operative approach for rectal cancer. And so not all patients now have to go to surgery, which used to be a standard of care for all patients, where all patients got chemoradiation therapy, then they went to surgery, and then they would get additional chemotherapy after surgery. But then we noticed a lot of patients weren't completing their chemotherapy after surgery, so the thought process is, can you change the sequence? And then on top of it, potentially preserve the sphincter and consider a non-operative approach. And so I think that, I think globally it is being well adopted in regards to non-operative management. And actually in the United States, currently we have a large phase 2, phase 3 study called the JANUS trial, which is basically validating that consideration for moving forward with a total neoadjuvant therapy approach. And obviously our European colleagues are doing the same. So a different study obviously, but same consideration. So the role of immunotherapy in advanced colorectal cancer for MSI-stable or MSI proficient MMR patients, that has not really been developed well yet. There are current clinical trials that are ongoing that are looking at that consideration. We know, at least based upon prior studies, that immunotherapy in patients with liver metastasis don't appear to fare as well. So now many of the clinical trials are actually making those patients ineligible for clinical trial participation. Now for our MSI-high or deficient MMR patients, immunotherapy is a standard of care in that setting, but obviously the MSI-high patient population is only 5% of all of our patients. That's not the majority of our patients. And there's very interesting data from CheckMate 8HW, which is nivolumab plus ipilimumab. It suggests that actually the response rates are higher versus what was reported in Keynote 177 with single agent pembrolizumab. And this is really just comparing immune check inhibition versus standard chemotherapy. CheckMate 8HW has not reported yet the other component of the clinical trial design, which is comparing nivolumab, ipilimumab versus nivolumab we don't have any of that data yet, and we all want that data. But currently, just based upon, in comparison to standard chemotherapy, nivolumab plus ipilimumab had a very impressive progression-free survival as well as impressive response rate. So we look forward to the final data.